We actually have a question for you that comes to us via Skype. We have Alisa joining us. Alisa, thanks so much for being with us. We really appreciate it.
Hi.
What question do you have for Dr. Curley?
I was diagnosed with stage 4 colon cancer, and I've been battling cancer since 2012. I've been through a myriad of chemotherapies, both oral and IV. And recently I was told to now find clinical trials. And I'm scared. This is my life I'm talking about, and I need to get as much advocacy and information and advice as I can in looking for clinical trials.
First, clinical trials are a good idea in your situation. You mentioned you've been treated for several years now. You've received the standard types of chemotherapy. And the problem is cancer cells can become resistant to chemotherapy drugs just like a bacteria gets resistant to an antibiotic. So clinical trials are very important for two reasons. First, they allow us to study new drugs that have been designed and developed for a specific cancer. There's good scientific evidence to suggest that they may work based on studies in cells or animals with cancer. But the second important thing it gives to us is it allows us to see, does this drug work in humans? Is it effective? And what, if any, are the side effects? And so the side effects are an important component of it. What I would advise you to look for in clinical trials is, based on the molecular studies, the genetic studies of your cancer, find drugs and use your physicians, use government resources, NCI.gov, NIH.gov. There's lots online that helps guide you to find drugs that have a reasonable chance of prolonging your life and producing a good response in you.
Thank you.
Alisa, you keep
You're
fighting,
welcome.
and you know, we want you to have a day to relax a little bit. We reached out to Spa 66 in Fort Lauderdale. They're going to provide you with a spa day so that you can enjoy yourself a little bit. And we wish you nothing but the best. Thank you for asking your question. We really appreciate it.
Thank you.
And I want to thank you, Dr. Curley, also for writing a book like this, because I think when you take away someone's hope, you take away maybe the one thing that provides them the inspiration to keep going. And what's great is everyone in the audience is going home with a copy of Dr. Curley's book in my hands. I encourage everyone to check it out. Honor and a privilege.
Thank you.